Hello everybody, my name is Mohamed Sadiq, and today we'll be talking about how to determine the rhythm on an ECG. Normal sinus rhythm is the normal rhythm on an ECG. What that means is that the electrical depolarization is starting in the sinus node of the heart on the top of the right atrium, moving through the atria in a normal manner, stopping at the AV node where there's a little bit of delay, and then depolarizing down the His Purkinje system, giving rise to the QRS complex. That is normal sinus rhythm. How do we know on an ECG that the patient is in normal sinus rhythm? Well, there's 4 things that need to happen. Number 1, the heart rate has to be between 50 and 100 beats per minute. Number 2, there should be a P wave preceding each QRS complex. Number 3, there should be a QRS complex following every P wave. And number 4, the P wave should have a normal axis, meaning the P wave should be positive in leads 1 and 2. If you have all 4 of those things, then the patient is in normal sinus rhythm. We've already discussed how to measure the heart rate on an ECG. This is an example of normal sinus rhythm where the heart rate is between 50 and 100 beats per minute. In this case, the heart rate is approximately 75 beats per minute. The second thing we look at is, do P waves precede QRS complexes, and do QRS complexes follow P waves? So the ratio should be 1:1. 1 P wave for every QRS complex, and 1 QRS complex for every P wave. P wave followed by a QRS, and QRS preceded by a P. That tells us that atrial depolarization precedes every ventricular depolarization, and ventricular depolarization follows every atrial depolarization, so there's 1:1 ratio between the top and bottom chambers. On the same ECG, we see that there's a P wave preceding every QRS complex, and there's a QRS complex following every P wave. So the relationship is 1:1. So this ECG has a heart rate of 75 beats per minute, and there is P waves preceding every QRS, a QRS following every P. So far, it satisfies the criteria of normal sinus rhythm. Finally, the P wave should have a normal axis. Now, we will be talking about how to measure the axis on a different lecture. However, if the P wave is positive in lead 1 and lead 2, that means it must be originating in the top right of the right atrium, and the wave of depolarization must be traveling towards the bottom left, which would be the case if it was originating from the sinus node. In other words, sinus rhythm. So here, as you can see, the P wave is positive in lead 1 and lead 2, so it is originating from the sinus node, and because we satisfy all 4 criteria, this is an ECG of normal sinus rhythm. Now, why is it important that the P wave have normal axis? Well, at times, the P wave could be originating from somewhere in the atria other than the sinus node. The rate could be normal. Every P wave is followed by QRS, and every QRS is preceded by a P. However, the P wave has an abnormal axis, meaning that it's not coming from the top of the right atrium, it could be coming from somewhere else. This is an example of such a P wave. Here you have a P wave that's negative in lead 1 and lead 2, and this is what we call ectopic atrial rhythm, meaning there's another ectopic focus in the atrium other than the sinus node that has taken over the job of driving atrial depolarization. Now that we've discussed what sinus rhythm is, let's look at variations of sinus rhythm. Well, the rhythm could still be originating from the sinus node, but it could be slower than normal. If the rhythm is still originating from the sinus node with a 1:1 P to QRS relationship, but it's slower than 50 beats per minute, we call that sinus bradycardia. This is an example of sinus bradycardia. Here the heart rate is less than 50 beats per minute. There's a P wave preceding every QRS. There's a QRS following every P wave, and the P wave axis is normal, meaning positive in leads 1 and lead 2. So what causes sinus bradycardia? Well, sinus bradycardia could be a normal phenomenon. For example, in somebody with an athletic heart, meaning an athletic person who has built up endurance over the years, could have a resting low heart rate. That is normal sinus bradycardia. Also, when somebody is sleeping, the vagal tone, the tone of the vagal nerve is higher, and the heart rate slows down significantly. And it's normal to have sinus bradycardia during sleep or resting states. Sinus bradycardia could also be due to cardiac medications that can slow down the heart. However, sinus bradycardia could sometimes be abnormal in the setting of sinus node dysfunction, and we will be discussing that in another lecture. Likewise, another variant of sinus rhythm is sinus tachycardia. So because the heart rate is more than 100 beats per minute, we no longer call it normal sinus rhythm, rather we call it sinus tachycardia. And here you see that the heart rate is more than 100 beats per minute. There's a P wave preceding every QRS. There's a QRS following every P wave, and the P wave axis is normal. So what can cause sinus tachycardia? Sinus tachycardia could be a normal phenomenon as well. For example, if somebody's exercising or they're going through a stressful event, the heart rate can speed up as a normal body response. That will cause sinus tachycardia. Alternatively, if a person is sick for whatever reason, for example, if somebody is bleeding from a car accident and they're losing blood volume, or they have an infection that's causing their blood pressure to drop, the heart can speed up as a compensatory mechanism, causing secondary sinus tachycardia. In most cases, sinus tachycardia is a secondary phenomenon, meaning it's a reaction of the body to something else that's happening. And so in speaking to my students, I always tell them, do not treat sinus tachycardia. Do not give medications to a person with sinus tachycardia to purposefully slow down the heart, as it could be compensating for something else, and you may actually make them unwell. There is an entity called inappropriate sinus tachycardia, where the heart rate is fast for no apparent reason, but that is a very rare phenomenon, and we'll discuss it in a different lecture. Finally, we'll discuss sinus arrhythmia. Sinus arrhythmia is a rhythm where electrical depolarization is still originating from the sinus node. There's still a P wave before every QRS, there's still a QRS after every P wave. However, the heart rate is constantly changing, and it's actually constantly changing with inspiration and expiration. This rhythm is quite common in young, healthy individuals, and it is due to a changing sinus rate during the respiratory cycle. So with inspiration, the heart rate increases, and with expiration, the heart rate decreases. And this is due to a feedback loop from the autonomic nervous system. It has no clinical significance whatsoever, and is a sign of a healthy nervous system. And we call it sinus arrhythmia instead of normal sinus rhythm, but it is understood that it's a completely normal rhythm. Now we've discussed what normal sinus rhythm is. We've discussed different variants of sinus rhythm. There are also many arrhythmias in the heart that do not originate from the sinus node and are abnormal. This slide shows some of these arrhythmias. We will be discussing all of them in the upcoming lectures. However, for now, I wanted to make sure that everybody knows what normal sinus rhythm is and different variants of sinus rhythm. So in summary, normal sinus rhythm is where atrial depolarization originates from the sinus node. The heart rate is between 50 and 100 beats per minute. There's a P wave preceding every QRS. There's a QRS following every P wave. And the P wave originates from the sinus node, so it has a normal axis, meaning positive in leads 1 and lead 2. Variants of sinus rhythm includes sinus bradycardia, where the heart rate is less than 50, still originating from the sinus node. Sinus tachycardia, where the heart rate is more than 100, also originating from the sinus node. And sinus arrhythmia, where there is normal fluctuations of the heart rate depending on the respiratory cycle. I hope that was useful. Thank you very much for watching the video. Please subscribe and like for future videos. Thank you.